Hi there, it's Desire Mia, and I know it's a bit late for me to say this, but Happy New Year. And I know it's been a while since you've last heard from me here on Friendly Station. I promise you, I wasn't dead or die and come back to life, unlike my previous conversation. But I promise to make 2026 a consistent year filled with insightful, friendly conversations. And I plan to keep that promise. So without wasting any more time, today my guest is a forensic pathologist, a social media sensation, insanely smart, and overall a friendly person. Ladies and gentlemen, Dr. Yaseen Bismilla.
It's a friendly station.
I was saying I have to apologize for the circumstance in which you find me in. We had a scheduled load reduction earlier on, which of course, you know how these things go. It got upgraded to a power outage.
Oh gosh, sorry about that. Where is this?
As in Johannesburg.
In Joburg, yeah.
Yeah.
Very expected.
So I told myself that I am not going to cancel this one or postpone it.
Gee, no, you could have, hey? No, you honestly could have, hey? No, sure.
No, I'll tell you the reason why.
But I really appreciate the effort.
So what happens is there's this thing what I call the Murphy's spirit, which essentially is it comes from Murphy's law. That means that anything that is bad, that is terrible, it is bound to happen. So
100%. No, 100%. So if I can also come clean, I literally woke up like 10 minutes ago. Me and my partner literally overslept on the couch heavily. Literally got me sorted out in literally a few minutes. So I just got everything organized.
You see? So this spirit was like
terrible. I don't know. I had like a 2-hour nap, man. Took
that's
me.
insane.
The nap took me. So agreed, 100%. We both are here, Murphy's Law.
Yeah. Well, by the way, how was your cruise ship?
Oh, it was so nice. Sure. It was lovely. You know, it was.
Yeah.
I needed that. Hey, I need to leave. It's sure. I need to leave. I didn't understand it until I was like breaking down. Like a few days before, and I was like, I can't do this anymore. Sure, it was a lot. So well deserved, well earned.
Brave of you to go on a cruise ship. You know, let me tell you, me, in terms of boarding any ship, I just cannot. Well, thanks to Titanic, you know. So I just can't.
The whole forensic post on its own.
Yeah, let me tell you, while people are seeing romance at play, what I'm seeing is terror. And so thanks to Titanic,
100%.
for me, that ship has sailed, and pun intended there. So I'm great.
Well, it was my 13th cruise. So
Oh, you do have an experience there.
The waters know me. I know the waters well.
Okay.
Yeah, I know. When you're on the cruise ship, I promise you, it's the last thing on your mind. They keep you very well occupied.
I don't think my mind works the same as yours.
Other ways to die. On the cruise ship.
Yeah. But for me, I'm great. So you can do those cruises on our behalf. And by the way, I do love the hair. I love it so much.
Thank you so much.
Love the shade of
Thank
blue.
you so much. Had you called me a few minutes ago, it was an afro. You know,
Was it?
so I reached a stage. I reached a stage where I was going through all colors. I was going through blonde, red, and I was like, I'm going to go the wildest ever because I wanted a complete buzz cut. I wanted to go completely take all my hair off, and I was like, I asked my partner, he works very well with hair. I was like, bleach this thing to oblivion, make my hair white. Whatever color you feel you want to do with it. For some reason, this just held and just kept and just worked. And to get our hair like this color is crazy. So then for the past year, we've been repairing my hair. This is healthy repaired hair and is purely blue. It's quite nice. It's another mistake, another Murphy's Law.
You know, this Murphy's Law is haunting me because even let me tell you, even the previous episode with the professor.
Yes.
At that time, I didn't have my notes. I made every possible effort to gather my notes. I don't know what was going on that day, and today, lo and behold, power outage.
Last year was chaos. Last year should be cancelled. Like, it should be erased. Last year should just be erased.
Well, it looks like for me, the last year is this year 2.0, but that's fine. That's a, you know. While we were on the topic about hair, I myself have dyed my hair brown for almost like 3 years now.
Isn't it the best feeling? It's like,
yeah, and to such a point where people almost thought that it's actually my natural hair because I go, yeah, and they even asked me what shade of brown am I using, and well, unfortunately, I can't answer that question, because when I have like dye my hair, I just go to the shops, go to the aisles where that product is located, and I just look at the
pick if whatever's on sale.
The picture of the lady.
100%.
So this is the lady I'm going home with tonight.
And I'm gonna look at how it's gonna come out on dark hair. And that's the best part of having like a mental breakdown, is actually dyeing your hair, not knowing. Waking up a new person, your spiral is real, your spiral is showing on you.
Yeah.
You did well. There we go. It becomes you.
And now I did this not knowing that other people will actually be inspired and want to sort of do it for themselves.
100%. But do you see how something small might have such a huge impact? You never know. Because even now, I'm spotted a lot because of my hair, purely because of my hair.
Yeah.
And as you said, another playing around, a mistake. And now it's almost like a brand now at this point.
Do you know who you look like to me? You look like my last year's genetics head tutor. His name is Kishan Mahesh. Awesome guy, phenomenal.
Really?
I think maybe it's the blue hair. I'm not quite sure. Maybe it's the blue hair.
Maybe.
But I have a tendency of making lookalikes from people. Like, okay, this person and this look alike. But I'm told by people that that's not always the case. So I'm trying to show you a picture of someone I think looks like another person. I'm not quite sure if you're going to see eye to eye. I'm going to show you just one moment. And this is one thing I do, right? If I see people who look similar to each other, I would sort of like create a collage of those two people and put them side by side. So I'm not going to disclose how many collages of people I have. That's classified information. But I'm going to show you this picture right now. So the picture is going to upload right now.
Oh, wow.
For the listener, I'm going to upload this image live while this episode airs on Instagram at Friendlysation. So on the left, right, you have my my mischievous or mischievous in South Africa, as we'd say, nephew. The one who's wearing a sweater called I Run the Block.
Looks naughty, eh?
Yeah, very naughty boy. And then on the right, we have some random kid from YouTube, no relation whatsoever. And I thought these two people look alike. Wouldn't you say?
They do.
Thank you.
I can actually see the features medically.
Medically?
Medically. No. The white forehead, the white set eyes, the flatter nose bridge.
So I am onto something here, right?
That's it. You are. No, you are.
Thank you.
You should be one of those people that like sketches murderers or someone that's done crime, or come up with a picture, a diagram. I feel like you could see what they're saying.
An artistic bone. It's not awakened yet, but it's there. It's there. But maybe in your case, it's maybe you're not lookalikes, but maybe it's the hair color, because he also has like blue hair dye. What a coincidence.
It's crazy. Absolutely crazy.
All right. So I was going through your social media, and I might be off in my guesswork here. I gather you are from... Did you grow up in KZN? In one of your videos, you make use of the language isiZulu.
A lot. Sawubona. No. A good guess.
If you think about it, the people who are usually not native speakers of that particular language tend to get inspiration from the environment, right? So I assumed...
True. Like my parents, my mom can speak fluent isiZulu, like fluent.
And she grew
Well,
up where?
she's born and bred in KZN.
Oh,
In Durban.
so
Born and
that's
bred
where
in
the
Durban.
link comes in.
Reservoir Hills. Yes, but she when she got married to my dad, she moved to the Northwest, as most Indian cultures would do. So I was actually brought up in Potchefstroom in the Northwest. But my colleagues are all Zulu coded. They are African coded, Zulu coded. I have a lot of Zulu colleagues, and they thrive on my social media, and they they find me a lot of the trending audios. And the Zulus are crazy. It is it is the most ratchet aspect of social media I've seen ever. Our South African Zulus are from a different blood. Hey, their humor is different. They are ratchet. Those streets are dark. The humor is dark. It is so good. It is so good. So good. But no, I'm not from KZN. I can't speak a word of Zulu. Nothing. Ekibos is Zulu too.
Oh,
Because I started, I started in Bloem, and then from Potch to Tswana.
Makes sense.
Tswana in school.
Makes sense.
So,
Oh man,
Tswana suits is very similar.
I feel bad I got that one wrong. You know, I was sure I was gonna get it
No,
right.
but 80% of Indians are from KZN. You would have been right, probably.
I would have been. If a random white person, Indian or colored, were to speak to me in Sevenda, or maybe, you know, they take a picture or video and then they speak Sevenda, you know, I'm telling you, they are from Limpopo without a doubt. That's what guides my
200%.
guessing.
200%.
And so you growing up, what number were you amongst your siblings? I'm trying to guess your personality, where it comes from. What number are you? Do you have any siblings? Number three. Is it 3 and last?
I am the last.
Bullseye.
Look at you. Those investigative, journalistic vibes coming through.
Yeah. I'm like, no, this guy is what, you know, the most used word to describe a personality is bubbly. And he can't be the first one. There's no way he's number 1 or number 2. He has to be the last or second last, between those two.
And I don't have second child syndrome. And last, no. I'm the sweetie pie. I'm the baby.
Okay, so I'm curious to know, where exactly along your journey did you start becoming interested in the medical field? So was it during your childhood years, influenced by your environment? Because, you know, like a child's brain is like a sponge, like it absorbs and internalizes a lot of things. So let me tell you, like, okay, so this is a confession, okay? I hope it stays between us and the listeners. Growing up, we, like, when our dogs would die, we would bury them like in our yard. But that's like a tradition we no longer practice now. But after burying them, I would grow curious about like the carcass, like how it's taking shape, or maybe even falling out of shape underground, or, you know, like, and so that led me to read books about like dead bodies and mummified remains of ancient Egyptians.
Yes.
And
Excellent.
And that made me want to become like, at that time I didn't know what it was, and that was until I came across a series called Bones, and then boom, light switch. That's when I knew. Forensic anthropologist.
There we go. And I haven't watched an episode of Bones, hey, but I've heard this so many times.
You have not watched a single?
I tend to not watch.
We have to snatch your forensic pathologist card, because there's no way you can be a forensic pathologist without having had to watch Bones. That does not make sense. That's no.
Fair. I'll take you up on that. I might start just for you.
Okay, great. That's a homework for you. But although right now I'm actually studying human genetics. What an anticlimax, right?
That's so lovely. Not at all. Smarty pants, or the smart.
From dreaming about one day going to Egypt and, you know, studying mummies, to now going into the molecular level.
Goosebumps. 100%. I think that's what science, the love for science, that's exactly how you describe it. When you go from something so big to something so small, you understand there's a science behind it.
I can't wait until the day I officially buy a plane ticket to Egypt and go there for the next 10-20 years of my life. But that is actually the final act of my life. I'm gonna do that towards my old age.
Do that.
Um,
Manifest that. Do that.
I'm gonna
Do
manifest
that.
that.
Do that.
So, what was your period of realization to become, like, knowing that you're gonna become a forensic pathologist?
Sure. So, firstly, medicine was the first decision to make, and my two older brothers are doctors, right? And there's an 8 and a 9 year difference between us,
It's in the
between them.
genes.
So it's sure, and my parents were both teachers. They were both principals. So there was a strong ethos of work ethic, hard work. Can you imagine a mom and dad, both teachers, extremely strict household, very studious household. And I honestly I wasn't that kid that was like, I'm going to save lives one day. I'm going to be a doctor teller one day. I see myself in the clinic. I see myself as a GP. I see myself as a plastic surgeon. Nothing at all. But when my brothers got into medicine with their bursaries, etc., they really paved a path of, I need to work hard in life. I need to actually, I need to slay in school. And they used to do all the examinations on me, when they were going through med school and doing all the practicals, and they would come home and we would go to Joburg to see them. And, so in that high school, as I said, in that sponge period where I was actually considering what to do, it kind of became a medical household all of a sudden, and there was just this fascination of the human body. I'm not going to lie. I got 98% in bio in matric.
Whoa.
Yes. And
whoa, amazing.
Really, yeah. And it was one of those moments of, as you said, like genetics. I knew I knew I was going to go in a medical science direction. So when I applied for medicine everywhere, I got accepted for medicine. So I think it was more of I knew which broad field, and I had the smartness for it. I don't think I was emotionally or mentally or physically. I don't think anyone is prepared to become a doctor and prepared for medicine, prepared for 6 years of actual life-draining hell. But it was the one field I knew I was good in. And any advice I give matriculants now is look at where your strengths lie. Because in 20 years' time, sure, my love for bio and my good marks in bio and that has not changed at all, and that kind of drives me on the rough days. As you said, this in your human genetics. This is when I look at the human body, I see that, and that's what led me to go into forensics specifically. It is the human body, as you said, the human body that cannot talk, that has a lot to say.
So what I'm getting from you is this was not something that you actually thought of doing at one point in time. It is sort of like an evolution thought process, but it grew over time to manifest to where you are right now.
100%. 100%.
Was there a point where, like, because you're in forensic pathologist, right? The term here I'm highlighting is forensic, and so where you questioned your legal context, in which you find yourself, because like in some general pathologists, if I may say, general alluding to the forensic the pathologists you find in hospitals, they are chasing time, looking for the possibilities of helping find diagnosis for hospital patients, and you are perhaps also maybe chasing the time because, let's face it, dead bodies also decompose per second. I mean, let's be honest here. But you're looking for answers for what has already happened, I mean, of course we need answers for untimely deaths, but and like this is like a poor phrasing, so I humbly beg your pardon for this. When did, in your eyes, the benefits of forensic pathology sort of outweigh the benefits of general pathology?
So what you're speaking of is two aspects of pathology. The first one is called anatomical pathology, and the second one is forensic. So anatomical pathologists, they sit in AMPATH, they'll sit in our government labs, they will diagnose all the cancers, any skin biopsies, they'll give you a diagnosis, and then the physicians will use that to treat the patient. Where I am still a pathologist and I can do exactly all of that, just on the non-living, so on the dead. So during our specialization in forensic pathology, we spend time in anatomical pathology. We have to know every single thing they know. If you die right now due to a natural disease, a cancer, I need to look under the microscope. I need to diagnose what you have died of. Likewise, anatomical pathology rotate in forensic pathology. They need to see, they need to shiver how organs look, how it looks macroscopically, how it looks big, so they can understand what they're seeing when they see it on the microscope. So same, but different. They work on the living, and the time constraints are very strict there. We work on the non-living, and the time restraints are not as strict, because as you noted, it's in two halves: the completely legal forensic aspect, and then the pure medical pathologist. And you're right, my direction of thinking was in the pathologist.
I see. All right, so the correct term is anatomical pathologist here, not general. I used general, I don't know why. Maybe I was just panicking, like, oh, what is the term for this one? Come on, brain, help me out here.
Specialized specialties. They're very niche. They're very specialized. Anatomical pathologists are the smarty pantsers. They're the smart kids of the class, the quiet kids of the class. They get 90s. They I would never go in that direction. Yeah.
I now come back to my question, and think about the fact that actually, you know what, there isn't really a job that is more important than the other. And now I want to think of examples, and I don't know why, but I'm going towards farming. We have a plant farmer and we have a animal farm, livestock farmer. Say if society then regards the plant farmer higher than the animal farmer, it means then that the animal farmer is going to go down and production is going to decrease, and thereby we won't have sufficient protein for the population essentially. So we need to balance equally. So as much as we have anatomical pathologists, we need to have forensic pathologists.
100%. 100%. Which doctors work for the dead? They are none. And that is where the scales now are balanced, as you said.
So let's go back a bit. You alluded to going to medical school. So what did you obtain? An MBBCH or MPCHB? Bloom is MPCHB, right? University of Free State.
Something a lot of yes. Physics is an MBCHB, and it's
MBBCH adverts.
MBBCH adverts. I don't know why I do that. So MBCHB of the Free State.
And that is a 5-year program.
In the country that offers medicine and finance. Yes.
And next up, you graduate. Congratulations.
Yes.
And you do your internship or what? Community service?
My internship, that's 2 years at Joburg Chen, Charlotte Matleke Academic Hospital in Johannesburg.
Oh, and was it your first choice?
It was my first choice. My two brothers were at Joburg Chen.
Aren't you just a lucky feather? I
honestly was. They used to do my calls for me. They wouldn't know which Dr. Bismilla was on call. So I would just say, it's my brothers. And they would help me out so much, Shane.
You are so lucky. We see on the internet, right? Newly qualified doctors are scrambling for crumbs, basically. And you get your number one top spot. That's wow.
No, I was sure. Yeah, I was very fortunate, again, very thankful. But sure, I think, again, then God was like, I've given you enough. Because ComServe, there were no posts available. There were no paid posts. So they were unpaid posts. I was actually placed in Rustenburg. And I was like, there's no way I can logistically live in Johannesburg, work in Rustenburg. Sure, such a disaster. But anyway, long story short, I was unemployed for 2 months looking for a job. And there was a rape center in Pretoria who was like, listen, no one wants to come here. We have a space for you. And sure, I was very thankful then to get into the medical legal or the forensic aspect through clinical forensic medicine. So there's 2 aspects of forensic medicine, one for the living, one for the dead. And this was my introduction to forensic medicine as well. I was placed in this rape center where I dealt with GBV, I dealt with rape victims, assault victims, child abuse, elder abuse firsthand. And that is where my passion for forensic pathology actually, we're not exposed to it. We're not exposed to it until you actually see it. And then it was that aha moment, that Oprah moment for me. I was like, sure, this is what I want to do. I've never had those moments in my life. One of the few.
I'm still waiting for my aha moment, but I actually have a third of an aha moment in genetics. I had it like maybe in first year. I'm like, I'm questioning my decisions now. I think it's time to pivot. Let's pivot.
When you're in Egypt, it'll make sense.
Doing my final act before Dr. Yaseen Bismilla comes and sees my, the state of my body.
The hell out of you.
All right.
Mummify.
And so your interest into specialization came at ComServe, and that's when you decided to choose to specialize in pathology. And so after your ComServe, I don't know why am I talking like I'm part of the club here, ComServe. It's community service here. It's community service, not ComServe. So after community service, do you right off the bat go into pathology? And while we're at it, right, please explain how we, and by we I mean you, obtain the forensic pathologist designation. Like, is it like a specialty or a sub-specialty? That's what I want to get.
Goodness, it's a full specialty on its own, complete full, like a pediatrician, like an obstetrician, like a gynecologist, like a surgeon. It's an entire complete specialization course. So when I was in the rape center, I got a clinical forensic diploma, and that is a postgraduate diploma which makes me an expert in clinical forensic medicine, not a specialty. So there isn't a full specialty for the clinical side. So I had to dip into the forensic pathology side, which is the dead people side, in order to become a specialist in forensic medicine. That would be for the living and for the dead. And I was so passionate for the rape center and for the clinical forensic that I was like, the only way I can do that is to become a specialist in forensic pathology. And that was when I was introduced to the dead body and the dead. So straight out of ComServe, I shadowed there. I applied for a specializing post there. Because of my diploma in clinical forensic medicine, it put me in the perfect candidate position to specialize in forensic pathology. That is for the dead. That is when I started my autopsy journey. That is when I started to do the medical legal examination on dead bodies, and that's a 4-year specialization.
Jeez, 4 years. Oh my goodness.
That makes sense. 4 years ideally.
Oh, there's this question that I don't know where I got this information from, so I just want you to fact check it for me. So it says that after your MPCHB, then you go to internship, then community service. Okay, at that point, do you need to go into a specialty immediately?
No. So then I'm a GP. So I'm a GP. A fancy word is a medical officer, right? So I can then shadow as a doctor in a subspecialty and be paid for that. So you can be a medical officer in orthopedics, in forensic pathology, and anatomical pathology. So my first year was a medical officer in forensic pathology, so this is after ComServe. Then I started my 4 years of specialization. So people usually hover if they're not sure, and they hover and they hop around in that medical officer space. The danger there is almost like a gap here. You get stuck in a chronic, they're called like chronic MOs, medical officers, where they are stuck in specialties, but they never specialize. they.
And so there's not like a limit put in place that you have 3 years up until, you cannot specialize. You need to specialize within this time frame. Otherwise, you're going to be stuck as a GP for your entire life.
And people do that, right? It's a calling. Being a GP, I'm not, no shade. As you said, everyone has their place in the system, and the GPs are at the bottom, and we need them. We need the bulk over there, and then we need our specialties.
I was like thinking to myself, like, how is this like a Spirit Bomb type of a personality pursuing this gloomy profession? And Spirit Bomb, that's a Dragon Ball Z reference. I don't know if you picked that up.
Yes. I did 100%. I'm the biggest Dragon Ball Z fan. It's not even a joke. I've watched every episode. I've watched every single episode.
You mean you started in 1981 to watch Dragon Ball when you
Every
started?
single episode on SABC2 at 5 o'clock every single day.
And to think it started that long ago, it's like what?
Friend, I was a child. I used to draw them. I used to draw Goku. I used to do the spirit dance. Sure, the fusion dance. I went to Japan. I went to Japan specifically for Pokemon and Dragon Ball Z.
No ways. You are a super fan.
Oh yeah. Oh yeah.
I digress. But anyway, from my eyes, okay, now we're talking your career here. From my eyes, like South Africa has become like somewhat a country where people in forensic science, they are targeted, because of the answers they might find. And one particular job I'm thinking about is forensic auditing. And while I'm thinking about this question, I can't help but think about the late Babita Deokaran. What happened to her? That was a terrible story. Terrible. It was a tragedy. So I do hope justice prevails for her murder. But you are able to find these answers which could possibly lead to prosecutions, and so the perpetrators, so these people that are like pulling the strings and orchestrating these murders, do not want to be brought to book. So doesn't that somehow deter you from pursuing this passion of yours, knowing you might be targeted? Of course, this may be if you are pursuing a high profile case, or even knowing that there might be resistance from your findings due to some, I don't know, political involvement. Or do you just simply deal with Jane Does? That's what I want to know.
Oh God, no. I did not study that hard. It was a very grueling specialization, and the work is not easy. The science is not easy. The science is specific. The science does not lie. So you best believe when we examine a body, if it is a John or Jane Doe, or if it is a reverse gender, for example, we will give an impartial, objective, medical. So we are doctors. So the postmortem report is a medical report. It is tailored for medicine and tailored for the courts. We are perfectly placed not directly with the police, because that's more of the community, it's more of the political pressures from that side. And we're not placed with the courts as well, where that becomes legalities, it becomes civil suits, it becomes criminal suits, it becomes money. We're impartial, and we are not so what's the word? We are not so influenced so much by, as you said, the deterrence, the bad press around it, the pressures around it. We are objective, we are doctors, we are dogotellas. You can imagine it's not our specialty to get involved too much. We liaise. So in my report, I will say I spoke with ABCDFG, and we are legally bound to give scientifically objective postmortem report complete on every single person, baby, fetus, skeleton, decomposed. We do not discriminate.
Oh, so and that what isolates you from the rest of the investigation? You are like, okay, we're gonna compile these findings, and once we're done with them, we will submit it, and it's up to the law to take its course.
Yes, but we do go to court. So we are subpoenaed to court, where we are expert witnesses. We don't have to specifically defend our autopsy report per se, but we explain our autopsy, what they mean, and then we can scientifically tell the amount of force, for example, that was used, or if there's an allegation of A versus B, scientifically based on injury we saw on the body, it was most probably A, B, C, D, F, G. On the flip side, the other party can also hire a defense forensic pathologist to try and tear our reports or a state report to shreds. Just remember, the state autopsy is the first autopsy that was done. It is the highest standing autopsy. So we have a very high legal obligation to be very correct and very honest and very scientific in what we do. And we can even scientifically say, I don't know. That's a scientifically well-studied specialist level answer, on something that I'm not sure.
So essentially what we are shown on the movies, it's not true, where pathologists
CSI.
defend their findings in court, in the court of law. So that's not what generally happens here.
I go to prosecutors and I'm like, I see where you guys are coming from. I cannot say that.
And that's where I was actually heading.
Because on a side note, just you remember, we're not here to put criminals behind bars, right? We're also here to exonerate, right? Just to remember that. So we are objective.
Okay, now let's get into the action, the blockbuster content here. I'm gonna start with this question, and I just jotted this today, this morning. So it's probably my subconscious also wanting to contribute to this conversation. Who knows? Like, what are the chances in your work or in your experience that some of the dead people you are working on come back to life? Because I've watched YouTube videos. I don't know why YouTube, but it is my number one source of information these days. And these people on the videos, they are said to just randomly wake up from these mortuary refrigerators, or in some cases, apparently it's a legend. There's this lady, I think her name is Marjorie McCall. And so what the legend says is she fell ill and she was buried. I think it was 1700s. And so on that same night, the night she was buried, some grave robbers dug her up to steal her gold ring, and because she was married. And when they tried to cut her finger off, I'm assuming they couldn't remove it, manually. So they had to cut her finger off. And it said that she woke up and screamed, of course, scaring them away. And so after that horrifying incident, she went back home, of course, much to the shock of her family. And so
yes,
over time, when she eventually died, for real this time, many years later, it said that she was buried in the same cemetery, and her headstone reads, "Lived once but buried twice."
I love that. So it's rare, but there have been incidences that have happened. Sure, my social media, my followers informed me in Durban, in Phoenix mortuary, there was an incident of a lady waking up on the mortuary table, and this was just as they were about to do the wine session, as they were about to cut into her. I can't give too much of information about that case, but I know the doctor who was doing that case. She had got such bad hypothermia from being in the cold room for so long. She went to hospital and died and came back to the same mortuary.
Can I just interject a bit there? I'm so sorry to disturb you. I just want to say that if any way possible I'm going to die from something else, it has to be hypothermia, because apparently you just go to sleep. You don't feel any pain. Just go to sleep and then you're dead.
No, there's lots of better ways to die. We can discuss that
okay.
Off camera, but hypothermia is extremely painful. You can obviously get frostbite. Your body begins to shut down, but no. There's a very cool, it's called hide and die syndrome. When you're hypothermic, you begin to take off your clothes and usually begin to
and you feel hot.
Begin to burrow until you feel hot. So it's very bizarre behavior as well, which has been well documented. So you don't be found naked under your table somewhere out of hypothermia. But there were cases in Johannesburg as well, at Hillbrow as well. Someone had woken up in the mortuary, banging on the inside. The staff were hearing screaming. They were freaked out. They ran away. They did not help this individual, but this individual survived out of the mortuary. So these are uncommon. They are rare, but they do happen. Sometimes you're incorrectly medically declared dead. In the Phoenix woman, I think it was a medical issue. She was put into. She was in a coma and pronounced dead for a while. They cut the cord or the life support, but somehow she came back. The one in Joburg, very similar story as well. So we make sure now certify death correctly
Oh, damn. Talking about died twice, buried once.
Dude, she came back. She came back to that same mortuary to be cut for an autopsy by the
Imagine.
same doctor. Imagine.
Weird
I
stuff
was
are
like,
happening
yo,
out here.
she's a legend, a legend, a legend. But I am very uncomfortable when I hear stories like that. Like I am very uncomfortable.
You see, I have been misinformed because I watch, again, YouTube videos. I think this has to be slogan of the day. Desire watches YouTube videos. That's where he gets his information.
No, it is. Go on TikTok. It gets 1,000 times worse. I get tagged in all of these, like the Lazarus effect, where there's post-mortem spinal jerk after death, which I've seen a few times, and it's quite vulgar. They are awake. But yeah.
I had this impression that dying from hypothermia, you essentially not feeling pain. So these forensic anthropologists,
Sometimes. Yeah, sometimes.
they dug up a 500-year-old mummy from, I think this was in,
Wow.
I could be wrong, but it has to be South
Don't
America.
say Egypt.
No,
Okay.
not Egypt, South America. So she could have been sacrificed as a ritual for
Yes.
the land's fertility, and so 500 years later, her mummified body was in a great shape, and so these experts, when they go and analyze the body, they sort of alluded to the fact that she might not have any pain dying from hypothermia,
no, true.
including like victims of Mount Everest, those that go to
Yes.
that mountain
Yes.
and then they die.
Yes. 100%. And as you said from Bones, forensic anthropology, they come and help us out quite often from time to time. They are very smart. They can tell a lot from bones, a lot. They can date the bones from carbon dating. And as you said, when they come to the mortuary, or if they come to us in those, they're known as historical remains. We, as you said, we have to look for all the burial rites and things that are around and with the body to put it into context. That history actually gives us more information than what we actually look for in or on the bones.
In your videos, like, I just want to know, like, normally when we watch your videos, we see you in the kitchen, doing the dishes, washing the dishes. Like, do you actually go to the crime scene and I don't know, offer your expert eyes? Because there's something about an expert eyes that, your average detective cannot see.
100%. So part of the post-mortem examination starts at the scene. Actually, the first part actually starts at the death scene. We don't say crime scene, it's the scene of death, or where the body is found. And that forensic medical eye can give you a lot of information, especially about the time of death. If there's a dispute about the time of death, you can even measure the body to determine how long has the body been dead or not. Is it recent or not? How recent is it or not? Are the bruises fresh or not? There's a lot we can tell from the scene before it comes to the mortuary. And in the last scene I had, it was quite a shocking homicide. The blood was still warm, and they had then put the body into a freezer. So it was, again, well preserved, but we could tell it was recent. So there's a lot of things we can tell at the scene that makes it extremely important. So it's one of our core duties going to the scene, and not just for high profile cases. It's usually those obscure cases or the very severe homicide, so like multiple gunshots, for example. And we give a full report, which starts off from the scene, which gives a perfect story into the autopsy, gives a perfect story into court.
So you do go to crime scenes, okay?
Yes, detectives do the detective work, right? So they do the detective work. Some are actually quite freaked out by the circumstances at which they see the bodies here, right? They could be mutilated, it could be multiple stabs, could be a lot of shocking things on the eye. But for us, we see it as a body of evidence. It is shocking. It's been late nights in the mountains, initiation camps, seen it all. It is quite scary, but it is so important. We are doctors, so we have that doctor eye, but yes, a combined effort.
You are like one of those few people who's probably seen more dead people than people who are actually alive.
100%, 100%, 100%. And seeing it in the environment.
Yeah, and now I want to get into the mood in which you do things because, like, okay, I'm agnostic. I have to put that as a disclaimer. I'm not overly religious, so but everyone prays, at the end of the day. We all pray, even though we're not really, our belief system is not that strong. We just pray as as a mechanism to sort of protect our brain. For example, you might have written an exam, but you probably didn't do so well, but you pray so that it's not so bad that you get a supplementary or fail that module altogether, but we pray. So do you, when you go to your lab and about to work on what do you call them? Do you call them patients or do you call them, what do you call them? Cases.
So a case, yeah.
So when you're about
cases per day
to start your case, do you sort of like maybe ask the spirit that once occupied that vessel to help guide your findings? Maybe not physically, they might say, oh, look at my subclavian vein, or
yes, very smart. So not specifically like that. I am a religious person. I think I've prayed before every exam. I prayed before this interview. And when I say pray, I mean just a mental affirmation of God. A, B, C, D,
a
F,
mantra.
G. Good energy, good vibes, good mantra, asking the universe to conspire in my favor for whatever. And I think we get where we are, not by chance. There is some high power and guidance. I don't pray for every single case per se, but there are some cases, and the majority of the cases we start in the office already, where we look at the police files. So we peruse through the files. You can actually almost sense the horror when you're looking at the history, looking at the scene photos, if the police are there or not. And it's in those moments I'm literally like, oh my Lord, may God protect this person and protect me in doing this autopsy. And you'll be so surprised. It's those cases that when I go to court, I kind of say the same prayer for that case. So it's not all my cases, but the majority of them when this is what happened. Oh my God. And then, but I personally respect each body.
You have a sobering job. Like, I mean, how do you feel then going back home after seeing such horrific scenes at work?
Yeah. I actually had to ask my partner this because I was on Lotus FM recently, and I struggled with the answer. I actually struggled with the answer, and I think it's in the debriefing. So I do talk about the cases I see, usually with friends or family or my partner, because it is sensitive, it is graphic, it is shocking, it is legally sensitive as well. And I'm seeing a therapist now for the first time in a long time. I am actually finding I'm linking that I do see and experience a lot of secondhand trauma, and those have been almost normalized to me. But by speaking about it, I'm almost sobered up to the fact that this is not normal. This is not an everyday thing. Seeing dead bodies are not normal in the most unnatural ways. So I debrief often, and with intent debrief. I almost let go of the grief or of the burden of the cases that I've had on that day or on that week. And sometimes, like when you tell people a shocking story, they focus on something else, or they giggle over something else. And I think I love that. I love seeing it. Oh my goodness, with a normal eye for a split second. If that makes sense.
It does, and I'm glad that you're taking this avenue to sort of help your mind deal with everything, because it really isn't a great sight on a daily basis, or however frequently you deal with these cases. It can have a detrimental effect to your mental health, wellness.
It does.
So back to the social media life to sort of make things a bit positive now, because we're going a bit somber there.
Dark, yeah.
I see you tend to warn people about possible dangers, fatal dangers. Don't you sometimes think that what I'm going to tell people could take my job away? Or is it like popular
200%.
opinion amongst
Oh,
forensic pathologists to be like, an apple
yes.
a day keeps the angel of death away?
I need to use that. That is so good. That is so good. So when I started off my social media, it was sure shame. Back in the day, I was quite academic. I was fresh out of my exams, new specialist on the block. So it was very academically driven. So I can academically explain to you how a neck would look like on a hanging without giving any idea or clues or anything on how to do it. So the trigger warnings are more for the graphicness or the content per se, but it was always academic, and that is a safe space for me. I am an academic. I've done research. I have my master's as well. So,
Whoa.
and then there's the so that's my first goal and my first safety net. My second safety net is humor, right? So South Africans are funny. We love to make jokes
I
about
mean,
every single thing, especially the serious, hellish things, right? You said you mean, yeah, right? Right. So I think people don't get a look into the life in the mortuary behind the morgue. It is extremely depressing. It is extremely disheartening. I also don't want to lose empathy for the bodies I've seen, the families I've counseled and spoken to. So I try to find a balance between academic forensic pathology with empathy. So even my jokes or even my funnier posts, it will have an aspect of, oh, that's what happens in the mortuary. Oh, that's what happens at month end. Oh, that's how they do this. Oh, that's how they do that. And that humor kind of brings light into behind the mortuary, what happens inside the mortuary, inside the autopsy room. It also brings some education. When someone identifies their loved ones, ooh, they know what is happening in the back, why it might take so long, what are the processes like, and then again, they are smarter about death. And once you're smarter, you kind of buffer that scaredness zone, if that makes sense. You are scared of things you don't know. You're less scared of things you are more educated about.
oh yeah. I mean, of course, experience. You already know what's going to happen. And I guess that speaks to morbid curiosity, right? It's genetically ingrained in us to sort of go towards.
100%.
I think it's a way for our body to sort of anticipate danger, to prevent death. That's why we're morbidly curious.
100%.
But in my case, I'm not morbidly curious because I want to survive. I'm morbidly curious because I find it entertaining. I do like to watch a lot of horror movies.
True,
I watch it for
right?
entertainment.
You want the jump scare. Yeah. You want that scare factor. Almost, I mean, that's what the morbid curiosity is. So even like I tell so many certain people, I tell like so many doctors, like, shame, you diagnose heart attacks, you diagnose lupus, all these medical conditions. I get to see it, guys. You'll never know how that alcoholic liver looks like. I get to see it. I get to see you smoking for the past
Oh man.
60 years, So as it's that, as you said, morbid curiosity.
For me, I just find it entertaining. But the next person, actually, that is their survival manual.
We've all lost someone.
Final
We've
Destination
all lost someone.
or Thousand Ways to Die. I don't know if you remember that program.
Oh, remember it. I know it off by heart. It was how the forensic aha moment came. And I was
Oh,
like,
is it?
all makes sense. All makes sense. And now, surprisingly, if ever I'm in a situation, the first thing is how will this cause death? How will this die? How will this death scene look? It's actually become a problem because I don't think of how I could save someone's life in this environment. I think of how would this autopsy look.
Geez, you're already like picturing what's. Oh my God. Okay, yeah.
I can tell. I could almost tell, even in your situation in with no connectivity, what a death in your. Yeah, you know what I mean. It's that puzzle piecing investigative, the morbid side of medicine that draws me to the work I do.
So, Doc, there are questions that I actually wanted to ask you, but I think we're going to have to skip these because of time. But now I'm going to introduce, for the first time ever in this podcast, we have what we call
Lovely.
a listener submitted question. And this
Lovely.
listener, by the way, is actually a fan of yours.
Yes.
I didn't know they were up until I attended their TikTok live. So they invited me there to talk about the previous episode, and I might have mentioned who I am having in my next episode, and she was like, is it him? So I asked her to send through a question, and so I'm gonna play this question, and then once it finishes, you're going to straight up answer it.
What made him decide to put his career on social media? Because it's not usually a career you would showcase or anything on social media, but don't ask it like that. Find a better way to ask that question, because it's of its gruesome, nature and revealing nature. Why did he decide to educate people about his career? And yeah.
That's excellent. Wow, okay.
I mean, I'm gonna add on to essentially what her question asks, is that I think it's a great idea that we're having medical experts and researchers coming to social media, because previously it was looked upon as a terrible thing to do. However, that sort of opened like a space for misinformation and fraudsters to claim that they know, whereas they don't know.
Let's not even.
So I'm glad that you guys are coming on to the social media to find us. That's where we are, right? To find, because lies are free. Let me tell you, lies are free.
True. And people are gullible. People are gullible. They see what you show them, right? That's the whole point of social media. You see what I show you. You don't know what's happening. So, yeah. So my partner is quite a big influencer, and like on a huge scale. So I was very afraid of social media. I'll be very honest. I didn't trust it at that point. Again, being a millennial, again, still a bit old school, more as you said, YouTube or more journal based. Give me a book. Give me a medical journal to use. But I saw the way he used his social media to actually empower different causes and platforms to earn money, for example. And he kind of coached me on, listen, we don't know what forensics is. No one knows what actually goes on behind those closed doors. How do you show someone? And we all have that morbid curiosity. I can even hear from this listener's question. It's something she wouldn't even be asking if she wasn't exposed to it. And he kind of coaxed me into starting off social media purely for academics, purely for the medical society, and it was primarily to educate. And I think that dynamic changed as I got more comfortable with the camera. I'm also quite alternative, so I don't fit the mold of what someone would see a specialist as, especially in a field like mine. You would expect someone in a white coat, old white guy, I would assume. But this field is so new. It is so nuanced. It encompasses everything. It encompasses criminology, it encompasses anthropology, it encompasses empathy, it encompasses human beings, it encompasses a lot. And social media was that portal for me to put my career out there in a safe way, in an educational way, and in a funny, humorous way. And I almost say it's not my career, it's actually my personality, or you actually get to learn more about what I do via me. I'm just the best, so that makes sense. So it started off in one way, and now I feel it's gone a bit chaotic. But again, having fun with my career, having fun with a morbid field.
And by the way, the listener in question, her name is Janae. I should have mentioned that from the get-go. Janae. I forgot. So Janae, I hope you got your answer right there.
Yes, and she must pop me a question.
She must actually do that, Janae, because I actually was
I'll
shocked.
answer nicely.
I have a close circle of people in my life, and when she said she
Yes.
knew who you are, I was surprised because she's actually a veterinarian student at the University of Pretoria. We were actually classmates, first year, the
Lovely.
generic stuff.
Lovely.
So I was shocked. I'm like, oh man, this guy is famous.
And we consult them quite a lot. I remember once we found a hand. We were not sure if it was a child hand or a primate or like a monkey hand, and we consulted the veterinary doctors to come and have a look at the X-ray because I was like, yo, I do not know what a primate.
A vet. How do they fit into the picture?
So they do X-rays, obviously, and they obviously studied the bodies of animals. So they could tell if the thumb placement was human or not.
Oh.
And I don't trust
Okay, now it makes
I
sense.
don't trust Google much, right? Yeah. Also important to note, social media like TikTok and Insta have become search engines. They have become things we look for. I don't find myself going onto YouTube so much anymore. I actually find myself going into social media and finding people who are trustworthy with information. That's also a good platform to give such a career.
The Murphy spirit strikes again. So you see, I'm onto something. This thing actually exists. It follows me. It lingers.
It becomes you.
This Murphy spirit. But anyway, we are almost towards the end, and I also introduced something new to this podcast.
So exciting.
Dr. Bismilla, do you perhaps have any question you would like me to ask you?
Wow, sure. I've never thought about that.
Maybe I've not covered some ground you would like clarified on, or maybe I haven't covered some things you would like to share. Speechless, aren't you?
Medicine. Yeah, I'm sure I've been put on the spot so much, like in terms of questions.
So you think I've actually covered more ground?
You really have. But here's a question. Like, do you know of any forensic pathologists, like doctors who have specialized in forensics?
Okay, so I'm gonna ask you that question. Do you know of any forensic pathologist that specializes in what in medicine?
Oh wait, do you know any other forensic pathologists? Have you come across one?
Oh, well, of course you have. I mean, this is your field. It's dominated by fellow forensic pathologists. No?
Wait. Am I supposed to ask? Oh, sorry. You asked.
I'm sorry.
What would I want you to ask me? I was literally asking you that question.
You were. And okay,
My brain is buffering. Sorry.
And I do apologize for the listener who's not aware. It's actually 9 p.m. So
it really is. My brain is buffering.
Buzz crashed.
No, it's fine.
So this is actually a question that you want me to ask you. But it seems like you've mentioned, I've covered more ground. We have discussed everything that you think needs to go out there. So there's actually no question you'd like me to ask you.
I think so. Yeah, well, no. Well, I mean, based around that, if I can answer that. So I've never met another forensic pathologist.
No ways.
Before I went into this field.
Okay.
I didn't know of any of them. I didn't know they existed. I would honestly, I wasn't sure this was even a specialty. It was the exposure for me that actually got me into it. And there's only 80 of us in the country.
80
forensic pathologists, 80 NSA. So it is an extremely niche field. We are extremely overburdened. We're almost 3 times higher than what the international average should be for forensic pathologists to do autopsies a year. We see 3 to I would say even 4 times that amount. It is one of those fields that are not exposed to. There's not enough doctors in it. It needs some exposure. And it needs some people to actually take an interest into that dark side of medicine.
I get it,
So,
and I get
yeah,
some
there are very
specialty
few fields.
are so rare because let me tell you, the first time and probably the last time I met an ophthalmologist, right, was when I had to undergo an eye surgery, and ever since I have never
Sure.
met another one. So I do understand I get your point there. So there's a rarity in all these professions.
Yes. No, 100%. And then it's only after then do you actually understand, okay, that's what happened, that's what they do.
Where are they? We need them.
100%. No, true. And also I think some advice to budding medical doctors or even others in the medical field or in the careers. Forensics is a broad field, right? We have scientists, we have doctors, we have police, we have those in the labs. If you have an interest in solving crimes, in playing a bigger role in the justice system, in helping society, forensics is a beautiful mirror that shows what is actually happening in our societies. We have one of the highest crime rates in the world, the highest unnatural deaths in the world. You know, if you aren't afraid to get down and dirty with the underbelly of society, look into the forensic field. There's many opportunities.
You might not know this, but you may have actually answered my final question that was to follow this, which was what advice you would give someone who, wants to walk in your shoes. And that answer actually summed that up quite nicely.
Well, there we go. That's the buffering. But to further answer that question, I would also say, it is scary. It is scary. It does take an emotional toll. It is a bit of a shock factor. It's not for everyone. So if you have that aha feeling in your body, and when I went through Joburg Chain, every specialty, and I was not happy until I stepped foot into that rape center and examined a rape victim. And I think no one can say that. That is the most trauma on a different scale in our country. It's on a different scale. But when I was like, I want to know more about this, I want to be an expert in this, I want to do this for a living. If you have that, if you think you have it, I think, that's the advice I'll give.
Well, listeners, you have to have that, and that is what you have to have. Okay, so Doc, thank you so much.
Thank you so much, Isaiah. I really appreciate it.
Despite Murphy's Law, I think this was great.
We did well. We did very well.
Yeah.
We did very well.
Yeah. So to that Murphy spirit, it didn't win. It didn't win this time. It's not gonna win next time. So this has been great. Thank you for joining me, and I do wish you all the best.
It was such a pleasure. It was getting to know you.
And do you have an 8-hour restful nap? I don't know. Are you out of office ending?
I am. I'm starting tomorrow. Hey, it's like I'm so over it. That's why I'm only looking at your emails. My email is so triggering that I'm handling everything and everyone tomorrow from 8 a.m. Until then, I'm still on leave. I'm still off duty. So even this podcast was done off duty in my happy zone. The hell starts tomorrow, and I'm ready.
I feel so special. Okay. Good night and God bless. Take care now.
God bless.
Thank you for listening. Stick around for new episodes. I have very interesting conversations lined up for you. And don't forget to follow Friendly Station on @FriendlyStation on your favorite social media platform. I would love to interact with you there. Okay, bye for now.